On February 1st, Bernie Sanders and Ted Cruz had a debate on health care. It was televised on CNN. And a lot of people have very personal feelings about it and about who won. Most of it all seemed to stem around one simple question, and Bernie Sanders says it right here.
The United States is the only major country on earth not to guarantee health care to all people as a right. I believe we should move in that direction and say that if you are an American, you are guaranteed health care as a right, not a privilege.
For those people who agree with him, Bernie Sanders won. For those who disagree with him, Cruz won. That seemed to be all it was about for most of the people who just kind of used their feelings as the winner. Independently, I think if you looked at the people who have command of the subject matter and who threw out more facts, obviously Ted Cruz did win. Not that I think that Ted Cruz had a better position, he just did better of debating with facts and not getting countered. Bernie didn't counter him very often. But it got me thinking that most people don't actually understand what Bernie is saying. And I just want to get into the cost of Bernie's Medicare for All program and where the numbers come from. Now, late in the debate, Ted Cruz threw out this.
The liberal-leaning Urban Institute scored Bernie's health plan, concluded it would cost $2.5 trillion in the first year and $32 trillion over 10 years. Now,
he went forward to explain of all the taxes that would actually need to be raised in order for the government to pay for it. This was Bernie's response.
Quote, Wall Street Journal, October 29th, 2015. Ted Cruz's, Wall Street Journal, not my paper, your paper, maybe not mine.
oh no.
Ted Cruz's new tax plan delivers its biggest benefits to the top 1% of U.S. households, adding about 1/3 to their after-tax income.
Now, I'm not really sure what Bernie was going for, talking about Ted Cruz's tax cut. He completely dodged Ted Cruz's point. Now, why did he do this? Personally, I believe that Bernie Sanders doesn't have the same kind of command of the subject matter as Ted Cruz. Personally, I think Bernie is the idea guy and that somebody else has put all these numbers for him together. But I want to look in detail and I want to show you what he actually probably should have returned with. Now, on Bernie Sanders' website, you can see here, he says we spend about $3 trillion a year annually altogether, and he wants to put everyone in a Medicare, Medicaid for all kind of solution, implying that we spend about $30 trillion over 10 years, and he thinks he's going to cut $6 trillion off that in that 10 years time. Well, if you look at data, we actually spend around $3.2 trillion a year, so let's go to $32 trillion over 10 years, and he's going to cut it so that we only spend $26 trillion, and it's all going to be paid for by the government. Now, the first thing you're going to have is sticker shock, because if you know anything about the federal budget, the federal government only spends about $1.1 trillion on Medicaid and Medicare right now. And that, over 10 years, obviously is only $11 trillion. And Bernie Sanders is proposing to take it up to 26. People really get scared there. But you forget one term, and that the term is unfunded mandate. Medicare and Medicaid are both. Now, because it can get quite confusing between state and federal, I'm just going to lump them all in together for simplicity's sake of the government just doing it all.
Healthcare affects our families. It's our moms. Healthcare is our kids. It's the
So you add it all up, the Medicaid, Medicare from state and local governments into the federal budget, plus what people pay in their private insurance. Then you also add in prescription drugs, hospital bills, boom. That's where it comes out to $3.2 trillion. The big unknowable here are the millions of people who don't have insurance who are currently not using the system. How much extra would it cost to them for one to have services rendered to them, and how much would they use it, and how much else would they spend? But to really get to this number, we really got to look about where these numbers come from. And from there, we start with what the government normally pays for health care. Now, most people familiar with this debate knows this fact that the United States pays more per person for health care than any other place. And this is where a lot of these numbers start. Bernie Sanders' plan estimates the fact that he can drive the health care cost down per person in the United States to more of those places like England and Germany and Switzerland and France and all those other places that he likes to talk about. And if you use those numbers, his $26 trillion over 10 years is a doable number. However, many other places started off with what Medicare now spends per person, or what the U.S. now spends per person, and scaled that up, and then started subtracting where Bernie Sanders says that he is going to make improvements on the system. Now, if you take the population of the United States and multiply it by the average cost that we pay per person for health care, you get a number about $34 trillion. Now, the big thing is when Bernie Sanders talks about this.
The major problem. The major problem with the pharmaceutical industry is, you know what? They could double or triple the prices you pay for medicine tomorrow,
Senator Sanders,
and there is no legislation to control that.
The cost of prescription drugs, yes, is a big expense. And he assumes he's going to get the same prices that other companies do or other countries do. Now, the Urban Institute took that into account to some degree, kind of being a little skeptical that they could get all the savings that Bernie Sanders said he could. Another thing Bernie talked about were doctors.
Is we need tens of thousands more doctors in this country. We have a major crisis in primary care. There are areas in urban America and in rural America where people literally can't find a doctor to serve their needs. And one of the reasons, a number of reasons for that, one of them is you go to medical school, you can come out hundreds of thousands of dollars in debt. And then you're going to become a plastic surgeon, not doing primary care in an urban area or rural America.
Not really sure how free college equals more doctors, and not even sure how free college and more doctors would increase to less costly health care. While yes, some doctors do have substantial bills leaving medical school, the profit motive alone probably pushes them into a lot more specialties than just general care. And this becomes the main problem with a lot of Bernie's proposals. He doesn't actually put forward a whole lot of how he's going to drive down costs. Ted Cruz brought a number of them up during the debates.
A much bigger barrier than that is the fact that, in the last 20 years, the FDA has approved only 3 child cancer drugs. The United States, population controlled, delivers 3 times as many mammograms as Europe, 2.5 times the number of MRI scans, and 31% more C-sections. We provide more health care. Not only that, in the United Kingdom, for example, wait times. In 2013, you waited 72 days for cataract surgery. You waited 89 days for hip replacement, 95 days for knee replacement. There are 3.7 million people in the United Kingdom right now on a waiting list waiting for health care. The United Kingdom. The United Kingdom, a 2001 report, noted that 39% of women over 80 in the United Kingdom receive surgery for breast cancer, compared to 90% of the women under 50. And that women under, or men and women under the age of 55 were 2.5 times more likely than those over 75 to receive cancer treatments. More than 80% of older patients in the United Kingdom believe they're discriminated against by their government-run health care.
Yes, this is a form of rationing, and yes, it does drive down the cost when you're doing less MRIs and less surgeries. Bernie never countered this, and these are some of the things that actually drive up the cost of the U.S. health system. There are many others that also Bernie doesn't debate. This is why the Institute scored his plan so high. While he does insinuate that he will get some cost savings, he never puts out hard targets or hard goals of how he's actually going to get there. So that's why they take a realistic position of what he actually has said, not what he has inferred, in order to score his plan. So at the end of the day, is Bernie's plan of $26 trillion accurate? Probably not if we did it. But is the Institute's plan of 32 accurate? Also probably not, because they leave something out and it's actually not discussed. When it comes to single payer, that's not actually an accurate statement. Single payer is just one method of it. All these countries that have universal health care also do have private insurance that people can buy on their own. These stats are actually difficult to get, but you can find some things. When it becomes to 4% in, say, a place like England or France, where it could be as high as 10% of people buying their own private insurance, this would decrease the cost to some degree. How much would the U.S. have private insurance? It's unknowable, because you wouldn't be able until basically you did it, of who would go for the private insurance. So the reality is somewhere between $26 trillion and $32 trillion over 10 years. And taking those numbers, the government would basically have to increase the revenue it's taking by $1 to $2 trillion per year. And can the government pay for this stuff? Well, that's another debate, and that's another video. But I'll leave you with the last point, which I think is the best one that Bernie made.
Ted talks about the problems that exist in other countries in terms of waiting lines. He talks about rationing. We have enormous rationing in this country. When you have 28 million people who have no health insurance, that's rationing. When you have people who can't afford to go to the doctor or can't afford to buy prescription drugs, 1 out of 5 Americans can't afford the prescription drugs their doctors prescribe. That's called rationing. Except there's no rule on that. There's no law on that. It's just people don't have the money to buy what they need.
When it comes down to it, it is about rationing. Currently, the U.S. does ration by money. In other places, European places, ration through other means of government. It all comes down to about how much you're willing to spend on it, and that's the real debate we should be having.